And speaking of moms and kids, May is Mental Health Awareness Month, and children's mental health is a big part of it. We know that it is so important to acknowledge and pay attention to your child's health, but it can be a difficult topic to approach sometimes. And that is why we've brought in pediatric psychiatrist from Rady Children's Hospital, Dr. Willow Jenkins. Thanks so much for joining us.
Thank you.
I love that story we just aired about the mother's intuition, because I do feel like sometimes that is strong. But what should parents do if they do feel worried about their child's mental health? I mean, all you want to do as a parent is make sure your child is happy.
Oh, of course. And I think one of the most important things is to remember that children will show their emotions rather than necessarily tell you. So looking out for signs like changing in their sleep, their appetite, their behavior, maybe having more outbursts, being more irritable, or struggling more at school can be some of those signs. And if you're worried, the best place I think to start is by booking an appointment with your pediatrician and talking to them to do some initial screening and get pointed in the right direction. Schools also do have amazing resources, so that can also be another starting point.
Because sometimes as a parent, you're not sure because you're with that child sometimes, 24/7, except for when they're at school and their activities. So it does help to get a different perspective, especially from a pediatrician. So you can get that advice from the pediatrician, but when do you feel it is a time to perhaps have your child see a psychiatrist?
Yeah, so as child psychiatrists, we're experts in complex cases. And so when a child's really struggling to function, they're not getting to school, they're not able to make friends, they're struggling with family life and having symptoms of a mental health condition, depression, anxiety, then it would be time to bring in an expert like myself. And what we do is we help with assessment, gathering information, diagnosis, and then come up with a treatment plan. And the one thing I do want to say is that as psychiatrists, we don't just prescribe medication. Treatment plans involve so much more: therapy, working with schools, parenting strategies, exercise, nutrition, you name it. There's a lot that goes into what we come back with to help a child.
Is it ever too early to bring in your child for an assessment?
I love that you asked that, because I always say it's never too early when it's with a child. Don't wait until it's bad enough or the child's in crisis, because with children's mental health issues, if we see them early, we can do so much. Early intervention really is key.
And what about perhaps the misconception that, oh, but if we bring our child in too early, they're going to be labeled and that might do more harm than good?
Yeah, I always say the more information about your child, the better, and then you know how to support them. And luckily, stigma is reducing. Schools always have children with different mental health needs. It's much more common, I think, now to speak openly about it than it had been. And if we can get children support earlier, they're going to thrive rather than figure it out later when they're adults.
So in addition to making that first appointment with a pediatrician, what can parents do at home? It's hard, every day, I think, as the parent-child dynamic. I mean, what can parents do at home to support their kids?
Yeah, I have a couple tips. I think one is really prioritizing sleep, and there's so many pressures on kids' sleep, late sports practices. Keeping as much of a routine as you can is really comforting and helpful for children. The other thing I say is really make sure that you're finding ways to make your child be confident and really want them to be self-assured and feel positive about themselves. Don't aim for perfect children. They don't exist.
They don't. Right.
The other things I would say too is really making sure your child has an area that they thrive. This kind of ties into the confidence.
Okay.
But whether it's a hobby, a sport, or just an activity you do, have one area of their life where they're having success is really key. And then, as we said, being a parent's really hard. So don't compare your parenting to someone else's. Every child is going to be different in what they need and what works for them. And that just gets us all down a rabbit hole that doesn't make us feel good.
And if a parent does feel kind of overwhelmed and not knowing where to turn, where can families get help in San Diego?
Yeah, so pediatricians' offices actually here have a lot of embedded mental health services. So our children's primary care medical group with Rady's has behavioral health within the pediatrics office. And then if it's a more emergent situation, we actually have an urgent care for behavioral health in Mid-City, which is amazing. And in a serious case where you're worried about safety or your child's really not acting like themselves, we have a specialized emergency room, the Copley Psychiatric Emergency Center at Rady Children's Hospital as well.
All right, Dr. Jenkins, thanks so much for joining us.
You're
we always
welcome.
appreciate your insight.
Thank
Happy
you.
Mother's Day to you.
Yes, you too.
Thank you.